After I started taking the blood pressure medication, my erection was never the same. Does this phrase sound familiar? It is perhaps one of the most common complaints heard in consultation rooms around the world. A patient comes in, their blood pressure is finally under control, their heart is protected, but there is a new, silent frustration affecting their quality of life. They feel like they had to trade their sexual potency for their cardiovascular health. But is this really true? Is this statement a myth, or is it a scientifically proven fact? Do these antihypertensive drugs, designed to save your heart, actually ruin your sex life? This is a topic surrounded by myths, heavily influenced by psychological factors, but also grounded in some very relevant truths that you absolutely need to know. Today, we are going to dive deep into this issue. We will clarify whether your medication could be the culprit behind your erectile dysfunction, identifying exactly which classes of drugs are statistically known to cause trouble, and which modern options might actually help you improve your performance. Before we start naming names and pointing fingers at specific pills, we need to clear the air about a harsh reality. This is a crucial technical point that is often ignored. In the vast majority of cases, the culprit is not just the medicine. While some medications can indeed make things difficult, and we will list them shortly, untreated or poorly controlled high blood pressure is a much faster and more direct shortcut to permanently destroying your sexual function. We need to understand the enemy here. Systemic arterial hypertension is a disease that causes something called endothelial dysfunction. In simple terms, this means inflammation in the inner walls of your blood vessels. Over time, high blood pressure causes your arteries to become stiff, hardened, and less elastic. This damage happens all over your body, including the very small, delicate arteries that supply the penis. So, here is the uncomfortable truth. Frequently, the impotence was already starting because of the disease itself. The damage to the pipes was already happening silently. When you started the medication, you became hyper-aware of your body, or perhaps the slight drop in pressure was the final straw for a vascular system that was already struggling. The medication often simply highlights a problem that was already there. To understand why this happens, and why the medication can sometimes tip the scales, we need to look at the physiology of an erection. Getting an erection is fundamentally a hemodynamic event. It is a hydraulic process. It depends entirely on blood pressure and blood flow. For an erection to occur, blood needs to rush into the penis. Specifically, it needs to fill the corpora cavernosa. These are two cylindrical, sponge-like structures that run along the length of the penis. They are rich in blood vessels. When you are aroused, arteries dilate, blood rushes in, and these cylinders fill up and expand, creating rigidity. Now, consider the goal of antihypertensive medication. The objective is to reduce the pressure inside your vessels to protect vital organs like the brain, the kidneys, and the heart. The paradox is that in some specific cases, this reduction in systemic blood pressure also decreases the flow and pressure necessary to forcefully fill those corpora cavernosa. If you reduce the systemic pressure too much, or, and this is key, if the vessels in the penis are already damaged and stiff from years of high blood pressure, generating the pressure needed for a firm erection becomes a physical challenge. It is a matter of physics. Beyond just the blood flow, some specific classes of these medicines interfere directly with muscle relaxation or even the central nervous system, affecting your desire. So, let's get specific. Let's give names to the villains. If you are looking at your prescription bottle right now, these are the ones you need to be aware of. According to major international cardiology and urology guidelines, the classes of antihypertensives most strongly associated with erectile dysfunction are diuretics and beta blockers. Let's start with diuretics, specifically thiazide diuretics. You might know them by names like hydrochlorothiazide or chlorthalidone. These are often the first line of defense. They are the pillars of hypertension treatment in both public and private healthcare systems because they are effective and affordable. They work by helping your body get rid of salt and water. However, from a sexual health perspective, they can be problematic. The exact mechanism is still debated by researchers, but it is believed that these diuretics reduce vascular resistance in a way that limits blood flow to the penis. Furthermore, There is evidence suggesting they can affect the levels of zinc in the body, a mineral that is essential for the production of testosterone. Then we have the beta blockers. But we need to be careful here. We are talking specifically about the older generation of beta blockers. Common names include atenolol and propranolol. These drugs work by blocking the effects of adrenaline. They slow down your heart rate and reduce the force of the heart's contraction. While this is great for a stressed heart, it can be terrible for an erection. These older beta blockers block specific receptors that are involved in vasodilation, the widening of blood vessels. If your vessels can't widen effectively, blood can't rush into the penis. Additionally, a very common side effect of these drugs is fatigue, lethargy, and a general sense of tiredness. This acts on the central nervous system to dampen libido. You simply don't have the energy or the drive for sex. Some studies indicate that up to 25% of patients using these traditional beta blockers may report some degree of sexual dysfunction. If you are taking one of these and have noticed a change, you are not imagining it. But this is not a sentence to a life of celibacy. The good news is that medicine is always evolving. We have moved far beyond the limited options of the past. If your current medication is causing problems, there are modern alternatives with strong evidence of being neutral or even beneficial for your sexual health. Let's talk about the heroes or the safer options. First, we have a class of drugs called ARBs, angiotensin II receptor blockers. You will recognize these by the suffix sartan. Drugs like losartan, valsartan, and olmesartan. Current research suggests these medications are generally very friendly to sexual function. In fact, some studies have suggested that drugs like valsartan might actually improve sexual function in some men. The theory is that they block a hormone called angiotensin II, which constricts blood vessels. By blocking it, they not only lower blood pressure, but may also improve the health of the endothelial lining in the penile arteries, reducing oxidative stress. Another safe class includes the ACE inhibitors. These end in pril, like enalapril or ramipril. Generally, these are considered neutral. They don't typically boost sexual performance, but they rarely cause erectile dysfunction. They do their job of controlling blood pressure without interfering with the mechanics of your erection. However, the real game changer, the one that deserves special attention, is a newer type of beta blocker called nebivolol. Remember how we said older beta blockers like atenolol are bad for erections? Nebivolol is different. It is a third-generation beta blocker. It is highly selective, meaning it targets the heart more precisely, but it has a unique superpower. It stimulates the release of nitric oxide in the endothelium. Why does this matter? Because nitric oxide is the primary chemical messenger that tells your penile arteries to relax and open up. It is the fuel for an erection. In fact, Viagra works by preserving nitric oxide. Nebivolol helps your body produce it. There are clinical papers showing that switching from an older beta blocker to nebivolol under strict medical supervision, of course, can reverse the symptoms of erectile dysfunction in up to 70% of cases where the drug was the sole cause. It is a gold standard choice for the hypertensive patient who needs a beta blocker but wants to preserve their sex life. And speaking of nitric oxide being the absolute fuel for your erection, there is something else you need to know. While we wait for medicine to evolve, there is a bizarrely simple, all-natural 7-second morning ritual that is helping thousands of men naturally flood their bodies with nitric oxide. It works by targeting the root cause of the problem, the toxic boner killer enzyme that builds up in our arteries, something that pills only mask temporarily. If you want to restore rock-hard, long-lasting erections naturally, point your phone's camera at the QR code on your screen right now to watch a short video explaining exactly how this purple tonic works. I've also pinned the link to that video in the top comment below. Seriously, check it out. It might change your life. However, even with natural solutions available. Now, before you rush to throw your pills in the trash, we need to have a very serious conversation. This is the most critical warning of this entire explanation. Never, under any circumstances, stop taking your blood pressure medication on your own. Even if you are convinced the pill is ruining your sex life, do not stop cold turkey. Stopping antihypertensive therapy suddenly can cause what we call a rebound effect. This means your blood pressure doesn't just go back to where it was, it can spike dramatically and dangerously. This sudden rise in pressure can lead to catastrophic events. We are talking about an acute myocardial infarction, a heart attack, or a hemorrhagic stroke. These are life-threatening events. Furthermore, remember what we discussed at the beginning? If you leave your blood pressure uncontrolled, you are accelerating the damage to your arteries. If your pressure stays high, the penile arteries will become sick, rigid, and eventually clog up completely. Once that vascular damage becomes permanent, changing pills won't fix it. At that point, not even the best urologist in the world can easily reverse the damage. So, what is the practical advice here? What should you actually do? First, monitor your situation. Pay attention to your blood pressure numbers and your sexual function. If you notice a clear correlation, for example, you started a new diuretic and 2 weeks later you are struggling, don't suffer in silence. Take note of the name of your medication and make an appointment with your cardiologist or your urologist. This is a medical conversation, not a personal failure. Doctors deal with this every day. Ask them specifically, "Doctor, I feel like this medication is affecting my performance. Is it possible to try a different class? Could we look at an ARB or maybe Nebivolol?" Finally, do not underestimate the power of your mind. The nocebo effect is real. Sometimes, the fear of the side effect causes more impotence than the chemical itself. If you read the pamphlet and terrify yourself into thinking you won't be able to perform, your adrenaline will spike, and that adrenaline alone will kill your erection. Take care of your heart, treat your hypertension, but advocate for your quality of life. There are options, there are solutions, and you do not have to choose between a healthy heart and a healthy sex life.